Hi, Billy McClean, Head of Community Health and Care Services here for the weekly vlog. This week I've been really thinking about systems and processes and how they help or hinder our teams to really do the best for the people that we're trying to serve. And in particular at times of pressure, when those systems and processes can really be stressed and cause extra inefficiency and extra problems for the people working in them. So a couple of things in particular. One is a complaint letter that I received through where we had, with all the best intentions, lettered people out, and unfortunately one of those letters had found its way to the family of a lady that had died, and unfortunately that obviously caused distress and grief to that family, and that's really a matter of our record keeping and being able to ensure that our records keep up with the care needs of people. And I'm sure there's lots of examples where maybe something that's not quite as distressing as that, but those admin processes, those the way that we keep our records, the way that we then communicate with people, get in the way of good outcomes. The second thing is really thinking about teams around the practice, and there's going to be a big focus during 2022 about what that means for all of our teams. So how do we bring together all of our nursing and social work and care at home and AHP teams around that locality model to work more closely with GPs and third sector, private sector, community groups, and really make the most of that place-based approach. And that again is going to be really complicated and going to take some real thinking through at a really local level, and for teams to take on ownership of those local systems and processes and really make that work for that area and the people who live in that area. So those are two key reflections for me today. I suppose the other reflection is you might notice I have my uniform again. So last week I was at Cross House. This week I am going into South Lodge to lend a hand there. So still those real pressures on the system, and certainly, as I said on my last vlog, I'm valuing going and working alongside our teams and just getting a proper understanding of how that looks and feels in terms of delivering care in what is a very pressured system. But again, a big thanks to everybody who continues to work in that. The light is at the end of the tunnel. Certainly sickness absence is beginning to reduce and the number of outbreaks is beginning to reduce, so we are starting to see an improving picture. I did get a letter of thanks through for this week's vlog. So the thanks came through from a lady whose mum died on Lindsay Ward, and a huge thanks to the team on Lindsay Ward at Bigot Hospital, who were really person-centred, provided time and space for the family to come and visit the lady, and really fitted around the needs of the family and the lady. So a huge thanks to Lindsay Ward for providing that person-centred care, particularly at these times of pressure. And I know that Bigot Hospital has had difficulties with outbreaks and the number of staff off sick. So big thanks to all of you on Lindsay Ward in particular, but Bigot Hospital in general. So those are my reflections for this week. If you've got any thanks or comments or questions that you want included in next week's vlog or future vlogs, please do get in touch in the usual way. Contact Rachel and we'll make sure those are included. And until next week, speak to you then.